Hi, I'm Dr. Clive Evian, and I'm going to give you some top tips about how you should be dealing with HIV in your family. Top tip number one is that it's very important that you should relate to and treat people in the family who have got HIV in a normal way. I don't think you should make a very big fuss over them. I don't think you should treat them as if something is wrong. I think you should approach them like they've got an illness, as many other illnesses, and they need your support and your empathy. Tip number two, I would say, is it's very important that everything should be open and transparent, that you shouldn't keep secrets about members of the family, that you shouldn't talk amongst you about the person without them knowing things you're saying about them, because that makes them feel isolated and left out. So I think you shouldn't get into an issue of telling secrets about each other. Top tip number three is often in a family when someone's got a very serious illness, people don't want to talk to the person about that illness, and they get into a kind of conspiracy of silence. So it's very important that even if the situation is unfavorable, or even if it's very serious, or even if the person is dying, try not to avoid the subject. Try and open up the subject, talk about how they're feeling, and share your feelings with them as well. Tip number four is that everyone in the family should try and educate themselves as best as possible about HIV and AIDS, so that everyone in the family should know as much as possible about the disease, about the medication, and about the treatment. I think it's very important that everyone should be familiar with what's going on. Top tip number five, when someone in the family is having to take medication every day of their life, it's quite a burden for them, and they might some days want to not take what we call a drug holiday, or not take their medication, or they might feel depressed or disillusioned. So everyone in the family should encourage and remind and make a little bit light of the fact that they have to take their medication, but just be with them, encouraging them, in a way being their medication friend, just to ensure that every day they're taking their medication. Top tip number six is it's very important that everyone in the family, or those who are old enough, they should be able to recognize maybe some of the unwanted or side effects of the medication, so that if they start seeing that happening, they can help their family member deal with the issue. For example, if they start noticing a skin rash, or if they start noticing the person is going off their diet, or that they're running to the toilet more than they should be, they should then get involved and start suggesting that something could be wrong, and encouraging them to go and see about the matter. Because some HIV drugs can cause unwanted effects, and it's important that everyone try and recognize when those are happening. Top tip number seven, the family as a unit should try and create a healthy environment in the family. So if we talk about food and eating, everyone should endeavor to try and eat good healthy foods, to cook the foods well, and to have a very balanced diet with fresh food, fresh vegetables, fruit, and healthy food. Top tip number eight, besides trying to eat well, I think one should try and keep the environment in the home healthy. So for example, people shouldn't smoke cigarettes in the house. The air in the house should be nice and healthy. The room should be well ventilated, and you should try and not encourage anyone to smoke in the home. Top tip number 9, HIV is a sexually transmitted disease. In other words, you get it from unsafe sexual practices. So I think that when it's appropriate, family members should discuss HIV from a sexual perspective, and there should be an attempt in the family that everyone in the family develop very healthy sexual attitudes, that they make sure that they keep their sex lives very good and with integrity, and that they promote within themselves a ethos that in the future their sexual lives will be conducted in a safe manner, so that no one else in the family acquires HIV unnecessarily. Top tip number 10, HIV often affects children. Mothers can transmit HIV to their babies. However, we can prevent that, and I think the whole family should be aware that HIV can be prevented, that pregnant mothers should not, in our day and age, transmit HIV to their babies. There's treatment that can prevent it. There's better feeding practices that can prevent it. And these should be known in the family and should be adopted by the family. Okay, so I've tried to give you what I think are 10 very important tips for a family where HIV is an issue in the family. And I want to wish you well in the future, that you should view this disease in a healthy manner, that you should not discriminate against people with HIV, that you should avoid stigmatizing people with HIV. And I think together, if we all view HIV in a much more healthier, non-discriminatory context, I think we'll beat this epidemic in the future. Thank you.